Health workers in the Kigezi Sub Region are experiencing growing concerns over the persistent challenge of reaching targeted patients, particularly pregnant mothers, in need of antenatal and delivery services. The poor road condition and difficult topography of the region are causing delays in the emergency responses and routine medical visits. The healthcare professions, who are on the front line of providing crucial medical services, cite the difficult topography as a major obstacle. They say that the hilly terrain makes transportation to remote areas difficult, excavating the already inadequate road network. Dr. Nsabiyumva, the Kisoro District Health Officer, says that the hilly landscape, combined with poorly maintained roads in the Kigezi Sub Region, has resulted to unreliable transportation for both medical personnel and patients. Nsabiyumva further says that the pregnant mothers in remote areas find it challenging to access antenatal care due to the geographical barriers, hence the lack of prenatal services, increasing the risks associated with childbirth and maternal health.
Deliveries in health facilities, we are at 71%. Immunization rate, the DPT3, we are at 85%. And then antenatal, we are at 92%. The challenge is the terrain and the difficulties to get mothers to come to the health facilities because of the terrain, poor road network, and then the mothers also delay to come and reach the health facility.
Dr. Godfrey Mampabwire, the health in charge of Muko Health Center in Rwanda District, says that the difficulty in reaching healthcare facilities, killing labor, has contributed to an increase in home deliveries, posing potential risks for both mothers and the infants. He adds that the facility sees over 100 deliveries monthly, with about 30 mothers camping at the health facility when their time of giving birth approaches.
On average, Muko Health Center gets around 100 deliveries per month, and we always have mothers who are admitted as waiting mothers ranging from 30 to 50 per day, who leave their homes because we have a poor terrain and people come to secure their lives.
Dr. Emmanuel Futidinda, the health in charge of Chahafi Health Center in Chahafi Town Council Kisoro District, says that health services have at most times been expensive, not because of paying for the health services, but putting in a road in the transportation of patients. He adds that the absence of a professional medical assistance during childbirth in remote areas is a critical concern.
This facility serves a very big population that is located in remote areas that are characterized by hilly terrain. As you can see the hills. So if this facility was not here, I think health care would be very expensive for the people here, because that would mean the nearest places where they would have to access services from here would be Kisoro Hospital and Ntore Hospital, which are more than 20 kilometers from here. And as you've witnessed, the road network is not the best. So that would probably mean we would have many more mothers losing their lives during childbirth, and maybe losing many newborns and young children.
Local health workers are urging the government authorities to address the infrastructure challenges in the region promptly. They emphasize the need for improved road networks, especially in the areas with difficult terrain, to facilitate the timely and efficient provision of medical services. Additionally, they call for the deployment of specialized medical transportation, such as ambulances, for expectant mothers in remote locations.
Our request from the Minister of Health through the Permanent Secretary would be if Chahaf can be considered as one of the facilities to benefit from provision of a Land Cruiser ambulance that is fit for this kind of terrain, and can also accommodate equipment for stabilizing the patients en route to the higher level of care.
Honorable Dr. Nicholas Kamara, the Member of Parliament for Kabale Municipality, who doubles as the chairperson of non-communicable diseases on the Health Committee of Parliament, recently led the committee for an oversight in the Kigezi Sub Region. Dr. Kamara says that the hilly terrain of the Kigezi region highlights the critical intersection of infrastructure and public health, demanding urgent attention to ensure the region's residents receive the medical care they require.
In short, what we found out and what actually some members, for example, we had a member from Karamoja and Nakasumbura. We were very surprised about the terrain of this place, about how hilly and how hard to reach it is. And one of the reasons, as we have said, is that one of the concerns is that mothers who are pregnant cannot access health care. You know, contractions can come all of a sudden, and within within one few hours you are about to deliver. So we said that as a government or as a parliament, when we are appropriating, first of all we should aim at making this place putting it officially as a hard to reach area. There are areas like Karamoja which are called hard to reach areas, and there is an allowance for health workers.
Dr. Kamara further says that, as the committee, they joined the plea for intervention, recognizing the importance of accessible healthcare for the well-being of the population. He says that they will file a report to the Parliament to recognize all the districts in the Kigezi Sub Region as hard-to-reach areas so that they can be given priority.
We said that for the ambulances which are being distributed, people who live in such terrain, such hard-to-reach places, should get the first priority when we are giving out ambulances, and so on and so forth. But let me say from also that there are districts which impressed us, like Rwanda. Rwanda impressed us. What they did was to functionalize health center tools. There are not so many beds, but they put a health center is supposed to have a midwife. They gave the midwife what to use, and actually I was surprised that when the DHO was telling us, if you add all the mothers who have delivered from health center tools, they are almost more than the mothers who have delivered from higher health centers.
As stakeholders convene to address these challenges, the hope in these efforts will lead to the development solution that will bridge gap between healthcare services and the geographical hurdles posed by the hilly terrain of the Kigezi Sub Region. Nobati Yamachi for Kigezi Television.